Okay, so we are looking at another very important aspect, okay, during labor. That's the process of child delivery, and this aspect is trying to like give more attention to the baby that is being delivered. So fetal monitoring. Okay, so the most important part of this lecture is you trying to talk about why should you be monitoring a baby that's about to be giving birth, and what are the things you are going to be doing, okay, to keep monitoring the baby. So for fetal monitoring in labor, you could see different ways. Okay, you can put electrodes outside. Why some you have to put something through the vagina. You understand? So different types. So fetal monitoring during labor, is just all about you trying to keep an eye, on the baby's well-being. So you could be keeping your eye, trying to look out for signs, or your ear, trying to listen. Okay. So it helps to dictate if the baby is in distress, if the oxygen supply is not optimal or so. So types of fetal monitoring now, very important. Okay, what are the ways we can keep checking if the baby is doing nice or not? So intermittent auscultation, this when you use that Pinard stethoscope or Doppler device to be listening to the baby's heartbeat. Okay, so you do that every 15 to 30 minutes, and as the stage of labor is going down, you are doing it much more faster. Okay, so it helps you to check if the baby is doing very fine. Then electronic fetal monitoring, this is what we have the pictures all over. Okay, that one is continuous recording of the fetal heart and how the uterus is contracting. So types, you have the external, that's belts, is a belt, okay, on the abdomen. Okay, internal, this is when electrodes can be put down to the fetal scalp. Okay, so you use this, to keep checking for complications in general. So what are you looking for in all of this? Basal heart rate. So you are seeing that the heart rate is within range. Okay, you are trying to check for fluctuations. You are trying to check for accelerations. You are also trying to check for decelerations. Okay, so that's it for this fetal monitoring in labor. Okay, different methods to do it and why it is actually important.